Today, we're talking about something I get asked about all the time. What's the difference between PRP and PDGF? And why does PDGF matter so much for under eye rejuvenation or renourishment? So let's start with PRP. PRP stands for platelet-rich plasma. It's created by drawing your blood, spinning it down, and concentrating your platelets to get those growth factors. One of those growth factors is PDGF. But here's the important part. PRP is completely dependent on the health of the person that it comes from. So if you've been sick, if you have inflammation, if you're anemic, if you're run down, or you have chronic medical conditions, your PRP may not be as strong or consistent or helpful. And that's why results with PRP can vary so widely. So now let's talk about PDGF. PDGF stands for platelet-derived growth factor, but in aesthetics, platelet-derived growth factor is recombinant, meaning it's made in a lab under sterile and controlled conditions. So that means you know that the dose that you're getting is consistent every time. The potency is reliable and the performance is predictable, something that platelet-rich plasma simply can't guarantee. So how does PDGF compare to dermal filler? Because it's not a filler. Well, filler replaces lost volume, but in the under eye area, it's more complicated than that. You're working in a tiny space, you can get a lot of swelling, and you have changes in your bone structure. The ligaments, fat pads, and muscles sit on top of that. And as your bony structure starts to resorb, you start to see a deficit or a hollowing under your eye. So as that happens, everything starts to descend. So PDGF works to stimulate your body to regenerate tissue where it's placed. It's not filling, it's rebuilding. At Skin Clique, we use a proprietary, anatomically driven technique that's inspired by more than 10 years of our orthopedic and oromaxillofacial surgery colleagues with experience with PDGF. And when you support that deeper structure, the changes that you see at the surface are pretty remarkable. And we're currently doing research on all of this. So let's talk about the side effects. Well, the most common side effect of platelet-derived growth factor is when it's placed too superficially. True adverse events are exceedingly rare and typically transient. They're about 1 in 10,000 for comparison. Bruising from most procedures and aesthetics is about 1 in 10. And it's also important to understand who may not be a candidate to provide PRP. So almost everybody is a candidate to receive PDGF, but the patients who can't give platelet-rich plasma are those with hemophilia, platelet disorders, thrombocytosis, thrombophilia, including factor V Leiden and antiphospholipid antibody syndrome. The list is long. If you have a hematologic disorder, a bone marrow problem, chronic liver problem, active autoimmune disease, none of those patients can give PRP. If you're on chemo, if you're on blood thinners, if you have immunosuppressants or biologics like Humira or systemic steroids, if you're a smoker. So there, you can see there are a lot of reasons that you really would not want to use PRP coming from a patient who may have one of these conditions, but platelet-derived growth factor can be reliable. And it offers a more predictable alternative for patients. So who can benefit from PDGF? Well, patients who have mild under eye hollowing or even moderate, these patients tend to do pretty well. If you have moderate to severe, you may need more than one session of platelet-derived growth factor because we're stimulating the body to build tissue, and that takes time. We're not adding volume instantly like with filler. And how long do results last? Well, PDGF stimulates new tissue formation, so it can last anywhere from 12 to 24 months. Some patients choose to do a second treatment around 6 to 12 months for optimization. And the biggest question is PDGF FDA approved? Well, it is, but just not in aesthetics form, as it's called now, Ariescence, but it is and has long-standing approvals in dentistry and products like Gem 21S, in wound healing as Regranix, which was approved all the way back in 1999, in orthopedics as Augment in 2015, and it has indications for tendon healing, hair regrowth, and difficult wound healing, including topical use after Mohs surgery. industry. So in aesthetics, registry and clinical studies are underway, and we are happy to be actively contributing to this effort. We are proud to lead the way in research for PDGF and under-eye rejuvenation, and PDGF when combined with a scaffold like calcium hydroxyapatite for body treatments. We have validated clinical protocols, strict safety standards, and a commitment to responsible innovation. So if you're curious about whether PDGF under-eye treatment is right for you, or if you're a clinician following the research, make sure you're subscribed. Drop all your questions below, and I'll see you in the next video.